Thank you so much, and nice to see that so many people still are here. Last talk, but so my name is Martina Grumpert, and I'm a clinical psychologist and a PhD student at the Karolinska Institute in Stockholm, Sweden, and my research focuses on body dysmorphic disorder in youths, but also specifically on developing digital education for clinicians within child and adolescent mental health services. So today I'm here to present the main clinical trial of my thesis, which is a feasibility trial, and some preliminary results from that study. But before I go into the details, I will give you a brief background. So hopefully we've heard today that during the last 10 years, we've actually come quite a far way within the field of BDD research. And we do have effective treatment for BDD, where CBT is recommended at first, but when CBT is not enough on its own, maybe due to hard time engaging in therapy, due to depressive symptoms or severe symptoms, the guidelines also recommend the use of SSRIs. However, a big problem within mental health services today that we've also heard a lot about is that we often miss or misdiagnose individuals with BDD, and that few get access to evidence-based treatment. And there are several reasons for this. So first, thinking that psychological treatment is the solution to one's worries about appearance may be difficult for some individuals with BDD. And worries about appearance is often associated with a lot of stigma and shame, which can make it hard to talk about one's symptoms and seek mental health services. So when BDD patients present to mental health services, they often do so for other reasons, such as depression or feeling depressed and sometimes even suicidal. So therefore, it's really important that clinicians ask about these symptoms, and that also that they know how to do that in a respectful way. But that leads us to our next challenges, because BDD is generally not included in any standard assessment procedures within CAMS. We have a great lack of knowledge about BDD within clinical settings, which leads to few trained clinicians and long distances to specialist centers. And last but not least, there is today a big gap between research and clinical practice, partly due to lack of effective training methods, which makes it hard to implement evidence-based care into routine clinical practice. And this is not specific for BDD, this is a general problem, but together with these other challenges, BDD patients become a very vulnerable group. So therefore, we need to develop new effective methods to train clinicians and to try to disseminate treatment and knowledge. And looking back the 10 years in the field of more education, we can see that we've come a bit of a way there as well. There has been a big increased effort in trying to develop new effective training methods. And if we look at the last reviews published, we see that traditional training methods, like workshops and with no follow-up or self-studies, they are not effective enough. They tend to lead to increased knowledge, but not generally that the clinicians use what they've learned or improvements in skills. So to get clinicians to both learn something and use it, it seems like we need more active training involving multiple training techniques. And some studies that have shown good promise with that are studies related to the IAPT here in the UK and to the Veteran Health Administration in the US, where they've incorporated in-person training, ongoing supervision, whilst actively treating patients. But these are very expensive and resource-intensive interventions, so we need to develop less resource-intensive interventions, and that's where online training may offer a way forward. And also where my research comes in. So the aim of this study was to develop and validate an online education with supervision support, training clinicians in the assessment and treatment of BDD in youths, and evaluate its feasibility and preliminary efficacy. And our primary goal is that we wanted to increase knowledge about BDD and access to evidence-based treatment for BDD within CAMS. But our secondary goal is also that we want to find an educational model that could potentially benefit other mental health disorders as well. And this was a single-site pilot feasibility trial with national recruitment, including 30 clinicians. So there were doctors, nurses, psychologists, counselors, all working within camps across all of Sweden. And to participate in this study, you needed the time and support from your work to do this education during work hours. And for the ones working with psychological treatment, you also needed basic training in CBT. And our only exclusion criteria was that you shouldn't have had any specific training in assessment and treatment of BDD prior to participating in the study. And the online education consisted of weekly modules that took about 1.5 hours to finish. And the therapists or clinicians decided themselves when they did each module every week. And each module consisted of a theory part and a training part with exercises. And then through this platform, they also had contact with a supervisor that every week logged in and gave them feedback on exercises and answered questions. And then the education was also divided into 2 parts. So part 1 consisted of assessment, management of young people with BDD, and treatment recommendations or guidelines, both psychological and pharmacological. And part 2 was more like specific training in CBT for BDD. And everyone went through part 1 of the education, and then those who had as a role to conduct psychological treatment at their respective clinic went through part 2 as well. And then during, so I should say that the length varied from 4 to 7 weeks. And then during the follow-up, they also had the possibility to contact their supervisor on demand. And this was to try to support the clinicians to start using what they've learned. So this is how the platform looks when you log in. If you were here earlier today, you could see that it's the same platform as my colleague Daniel is using. But they have different modules with different themes that follow on each other. They can contact their supervisor here, and we gather all the work material. And the theory part consists of a mix of written text, videos, case examples, and work material. And this specific example is from module 1, where they get to learn what BDD is and how to assess it properly. The exercises, most of them are based on role-played cases that are like standardized BDD cases that I, together with some colleagues at the clinic, have role-played, and they get to practice lots of different things, as you can see here in the list. And then in this specific example, they get to practice doing the BDD Y-box from video clips. We collected measures from pre-training all the way to 6 months after training. And then after the training, we also interviewed a subsample of the participants. And the primary endpoint to evaluate the feasibility for the trial was post-online training. And we screened 30 clinicians, and 30 were deemed eligible to participate in the study. 5 were allocated to this shorter education, which was mainly focusing on assessment, and 25 to the longer education. And everyone has now finished their education and done their post-assessment. We've also done all the qualitative interviews, and at this point 18 have reached their follow-up point. But today I will only present pre-post results. So the majority of participants were women, and mean age was approximately 38 years. And they came from 6 different regions in Sweden, so a lot of different places in Sweden. And it was mostly psychologists, either licensed psychologists or I would say we could call it trainee psychologists. They finished their university degree, but in Sweden, when they work their first year, they're under supervision. And mean age or mean years of clinical experience within mental health services was approximately 6 years, and specifically within CAMS, 5 years. And most of the clinicians worked in outpatient clinics with a mix of general clinics and specialist centers. And Only 9 participants had experiences in assessing BDD in young people, and even less had experiences in treating young people with BDD prior to participating in the study. And it took about 32 weeks to recruit all the participants. And during the active phase, so when they were doing their education, time spent from the supervisor on each participant and week was approximately 18 minutes. And phone calls were like very few. They had the ability to contact us through phone if they needed to, but they were in general very few. So most was done like online. And adherence was also very good. We've had no dropouts so far, and all but 1 participant have finished all modules. However, they needed a little bit longer than 4 to 7 weeks to finish their education, but on average they were almost doing 1 module per week. They were also very satisfied with the online education. So as you can see, like mean ratings on all satisfaction items were between agree and strongly agree. So majority reported getting the education that they desired and wished for, that there were sufficient video examples and illustrations, and that these were helpful in illustrating like assessment and treatment techniques. And that the interactive case training with the exercises were helpful in learning how to apply these methods, that module length was appropriate, that they were happy with their supervisor, and finally that they would recommend the education to a colleague, and that they thought it was equally effective as traditional training. We also asked them if they needed more training, and in general, ratings were low. But there were 3 participants, 1 from this shorter group and 2 from the longer group, that reported needing more extensive training in CBT for BDD. And we also looked at, they also did a knowledge test, pre-post training. And this knowledge test was a mix of multiple choice questions and open-ended questions attached to cases. And the knowledge test was divided into 3 parts, mirroring the education. And all participants did part 1 and 2, and then the ones who did more training in CBT did the part 3 that was about CBT. And to compare these results, we calculated the scores on percentages of total scores. But as you can see, there was an increase in knowledge and skills from pre to post training, and the effect size was in the medium to large range. However, the mean difference, as you can see, was more modest. However, looking at self-efficacy, which is the clinician's own belief in successfully treating and assessing young people with BDD, we saw a large difference, and it was also associated with a large effect size pre-post training. So to summarize, the online education seems to be like a feasible intervention to train clinicians. And the user satisfaction was also very high. And we also have some preliminary result that it was effective in increasing knowledge and skills and self-efficacy. However, the knowledge test was, the mean difference, as you could see, was that the knowledge test didn't improve that much. I mean, even though we have okay effect sizes, and we speculate that this was depending on how, or this was based on how the knowledge test was developed and designed, and also how motivated the clinicians were in conducting it. So things can be done probably to both the knowledge test itself and how it was administered. And it would also have been nice to include some kind of objective measure to look at clinicians' skills. And even though supervision was less than 20 minutes per participant and week, we're thinking that it could be good if it's even a bit more efficient. But we're not finished yet. We have the follow-up phase ongoing, and we're collecting more data. So some of that is clinicians reporting how much they've used the education, which obviously we hope that they have. We're also following up with a qualitative study that will give us more information on feasibility and help us improve the online education, and then to fully test if this is an effective way to increase knowledge and skill and use. We're planning to move forward with a controlled, fully powered controlled trial. Thank you.